Are you dealing with complicated medical issues? How do you communicate with doctors and other providers? What are the best choices for treatment, care, and insurance? To what insurance coverage are you entitled? Are you frustrated by the healthcare system? Do you want to regain control of the challenges entailed in managing your healthcare? Hello, my name is Attorney Ramsey Borawi, and welcome to Your Money, Your Life. In this segment, my guest is Diane Savastano, a registered nurse and the founder and president of Health Assist. Since 2004, Health Assist has been offering expert help in demystifying healthcare and the scope of your medical insurance coverage. It does this by providing customized services that help individuals and families navigate the complexities of the healthcare system. Diane combines her experience as a registered nurse, a hospital administrator, an insurance executive, and also as a business manager consultant. This background uniquely qualifies her to understand healthcare from both clinical and insurance perspectives. She has appeared on NPR's Morning Edition and the PBS Second Opinion series. Diane, welcome to Your Money, Your Life. It's great to have you on the program.
Thank you. It's a pleasure to be here.
For some people, this could be very, very frustrating. They could actually get angry. So how does somebody, get over being frustrated and angry and kind of like regain control of the situation themselves? What do they do?
Well, that's often, what I'm often doing is helping them through that. Most of the time, people don't really understand how it all works. And sometimes they're interacting with people, especially in a hospital setting where it might be sort of a short, curt sort of conversation. Sometimes I will facilitate meetings so that we actually put the team together to talk about the situation that's presented itself. Often there's a lot of fear also about, especially going home, feeling like they're not going to be supported. So when we have those meetings, what we're doing is paying attention to every detail about what's going to happen when someone gets home so that they understand that they actually will be supported. But I have to say, in our healthcare system, there is just a huge step down in terms of, obviously, care when someone goes home, and we're having very high expectations of families to pitch in and to do things that in the past maybe only clinical people might have done before. But if you work with the staff, they'll often provide the teaching and the support. So, if I'm working with a client, I'm often there as well. So I'm kind of filling in a little bit, not providing direct care, but coordinating and there as a resource to troubleshoot and problem solve.
Let's talk a little bit about in-home care, assisted living, nursing home care. Do you get involved in those areas at all, or is that a totally different area?
Oh no, every single one of my clients is generally involved could be involved in all three of those. So, I'd say about 50% of my clients fall into the older adult category. Okay. And so oftentimes, when they're going home from the hospital especially, they do require in-home care, some of which is supported by insurance and sometimes not. Oftentimes, especially for older individuals, it might be a medical crisis that precipitates the decision being made that maybe now they need a little additional help, and maybe it's time to transition into assisted living environment. So I often will help people with that, but it generally comes because there's been some form of medical crisis. Okay. And the same with if people need long-term care. Often it's a continuum, and it might be the medical crisis that led to the hospitalization and then the short-term rehab, and then it's defined that this person really can't go home and they need long-term care, and so that's the decision that gets made. But when people are living in those alternative environments, I'm still consulting with them and making sure that what needs to happen does happen. Because when people are sort of taken out of the environment that they were in, say their home environment with their own primary care physician, their own group of specialists, but then they move into these alternative living environments, all of a sudden their team often changes. It doesn't always. If they go into long-term care, it definitely changes. So now we need to relay to the new team the baseline for this individual.
Okay. All right. Well, that's good to know, because primarily my clients are older, and they either are aging in place, and so they have in-home care, or they've decided for whatever reason to move into assisted living, or the continuum of care, as you put it, or their care is such that it's long-term nursing home care. They need to be in they need 24/7 nursing care. They need to be in the nursing home. And it's good to know that they can turn to somebody like you, and you can help coordinate that care wherever they may be, whether they're at home, at the assisted living facility, or in the nursing home. It's a good place for us to stop.
Okay.
Without a doubt, communication is crucial to good health care. Becoming a better advocate for your own health and wellness pays dividends. However, to do that effectively requires both knowledge and preparation. Moreover, such a task can become overwhelming and even impossible, as one is bombarded with both complex medical and insurance information. This is especially true for a person suffering from the stress of an illness. Fortunately, there are companies with whom you can team up. These companies facilitate communication among all members of your healthcare team. They provide emotional and decision support, promote wellness, and empower patients in their quest to take control of their healthcare. One such company is Health Assist, which helps coordinate the details of doctor's visits, medication, and insurance coverage. Also, Health Assist oversees and works with in-home care providers and/or assisted living facilities. Transitioning from the hospital to a rehabilitation facility, Health Assist can help with that as well. Don't be frustrated, confused, or overwhelmed. Rather, regain control of your health care. A good place to start is by checking out the Services tab on the healthassistcorp.com website. In closing, thanks to my guest, Diane Savastano of Health Assist. Diane, thank you for appearing on the program.
You're very welcome.
And thank you to you, our viewers, for watching Your Money, Your Life. My name is Attorney Ramsey Barawi, Building Your Trust.